Ayusin na. Good afternoon. This is the Research Defense of Group 4. The members include Aquias, Barongo, Bisda, Bonyon, Castaneda, Delenya, Idigpio, Medina, Umandam, Ramo, and Torio. The research defense is entitled The Effectiveness of Medical Consultation Application for the Students of the Technological Institute of the Philippines for school year 2020-2021.
Problems are, number one, how effective is the online consultation for the people who will use the application? Number two, how will the researchers make the application look legit? Number three, what are the limits of the medical consultation? And number four, what are the methods of the teledoctor consulting the patient? So for the background of the study, as the modern age came up the view, the information age came up wherein it is an age characterized by rapid growth in terms of technological advancement. As people stay at their homes due to pandemic, students of the Technological Institute of the Philippines come up with an idea to study the effectiveness of these medical applications to ensure that this application is helpful to its users. Online medical consultation is the latest and most popular way of distance consultation today. Technology-supported counseling is seen by numerous individuals as at any rate a fractional answer for the mind-boggling difficulties of conveying medical care to a maturing and progressively assorted population. The Well-being Administration faces increasing cases of persistent sickness and reliance. Yet, in an addition, an extent of residents who are certain to self-oversee disease and improved long-haul standpoint for genuine conditions like malignant growth. Lastly, there is a potential to evaluate the effect of new frameworks on discussion designs by removing routine information from training datasets. Staff and patients saw unobtrusive changes to obligations related with online alternatives. More noteworthy take-up requires great correspondence among training and patients, and the association of frameworks to keep away from clashes and abuse.
Ako na, Ivan. Explanation of the background of the study. Student of the Technological Institute of the Philippines come up with an idea to study the effectiveness of online medical application. Online medical consultation is the latest and the most popular way of distance. Technology supported and concealing seen by numerous individuals as a fractional answer for conveying medical care to a maturing and progressively assorted populace, and well-being administration faces increasing phases. Staff and patient saw an obtrusive changes to obligation related with online alternatives. More noteworthy take-up requires great correspondence among training and patients.
The research will be significant to the following entities: patients, doctors, medical facilities, future researchers. The scope of a study refers to the extent to which the subject area will be analyzed in the study and the conditions that will be used to conduct it. Clearly defined, where our study focusing on and covers. In terms of the significance of the study, it is simply explain why the research is needed.
Explain ko yung ano, Ivan, significant of study.
Related literature, virtual online consultations, advantages and limitations. Collard stated that the research literature on video consultations is sparse. Such consultations offer potential advantages to patients and the healthcare system, but fears have been expressed that they may be clinically risky and or less acceptable to patients or staff, and they bring significant technical, logistical, and regulatory challenges. Online consultation both has advantages and its limitations. This virtual appointment can allow you to contact a professional with your specific concern about your health. Consultation is traditionally done with physical interaction between medical man and the patient, but with COVID-19 pandemic, it brought risk upon a session. A reason why the technology supported consulting is to be public. Connect. Cameron 2020 stated that online healthcare consultation has become increasingly popular and is considered a potential solution to healthcare resources, shortages, and inefficient resource distribution. However, many online medical consultation platforms are struggling to attract and retain patients who are willing to pay, and healthcare providers on the platform have the additional challenge of standing out in the crowd of physicians who can provide comparable services. Online medical consulting provides a more convenient way and less risky in a consulting appointment, but at the same time, it limits the ability to conduct a checkup, especially for those patients in need more medical assistance.
Fred, Aquas, ay gagi, asan si Fred?
Experiences with online consultation system in primary care case study of one early adopter site. KCM, Shaw, S, and etc. That the, that the three related teams were identified online consultation system as innovation, managing the messiness of general practice, consultations, and redistribution of the work of general practice. These terms raise questions about what it means to consult in contemporary general practice. Uptake of teledoc by patients by patients was low. Much of the work of consultation was distributed to patients and administrators, sometimes causing misunderstanding. The messiness of consultations was hard to eliminate. In-house training focused on technical application rather than associate transformations to practice work that were not anticipated. GPS welcome varied modes of consulting, but the aspiration of improved efficiency was not realized in practice.
Technical support consultation, medical consultation helps a lot with the conveniency of the patients, but it gives misunderstanding with the prescription and how the doctor examine the patient because it is not face to face. So it is done through a techno support application. The next related literature is online medical consultation, a review of literature and practice.
Online medical consultation, a review of literature and practice. Albert 2011 stated that consumers are in favor of online medication services. E-visit offers benefits to patients in terms of access, speed, and convenience without risk of inappropriate or incomplete care according to the evaluation from Pittsburgh University, USA. In related literature, the researcher did a comprehensive summary of previous research from the resources relevant to a particular area in our topic. The aim of literature review is to obtain a better understanding of the current studies and to present that information in the form of a written article.
Respondents of the study. The respondents of the study are specifically grade 11 and grade 12 of the Senior High School Department of Technological Institute of the Philippines, Quezon City. The researcher will all use random sampling to conduct the survey with approximately of 300 respondents that needed to participate the survey who use or avail techno support, medical application or medical consultation with their regarding with their health issues. Conceptual framework. As you can see, we use the IPO model or the input process output. In the input, as you can see, this part includes the project the project, which is the medical consultation application, which is the to know the effectiveness of this project to the students. And by the process, the researcher will find or create an application that will be a way to connect with doctors or our teledoctors. And then with output, the research will show the result of how effectively use the techno support medical consultation.
Our research design recorded here the design of our research and clearly neat and clean our work and the essential of the conceptual framework are noted. We choose this place so that we would know the result of our research and they will guide our research to strengthen our research. And we know that people in this area are serious. They won't take our research seriously.
Hello?
To get appropriate data needed, the researcher made questionnaire with three parts. Part 1 is about the personal identification of the respondents, which includes questions like gender, age, and year level. Part 2 is the evaluation of the application. This will be mechanic to know the performance evaluation with their experience in using online application. There will be choices and checklists to evaluate with statistical data. Part 3 is contained of 3 questions include the following. What are your recommendations with the application? What are the troubles you are experiencing while using the application? And lastly, how do the doctor examine and give prescriptions? For data gathering procedures, the respondents are among the grade 11 and 12 of the students in Technological Institute of the Philippines, or TIP Quezon City. Since they are the qualified respondents for this research, researchers will ask the research advisors for the validity of the questionnaire made by researchers and ask for the permission of the principal. The sampling method that will be used is random sampling, and there will be a total of 300 respondents needed to participate in this research study. The researchers will be distributing questionnaires randomly to the grade 11 and 12 senior high school students through the use of Google Forms due to the pandemic. The researchers will be giving a copy of the Google form randomly online to identify if the student is currently grade 11 or grade 12 and if they are enrolled in Technological Institute of the Philippines or TIP. After the gathering of data, all the data will be collected for tallying scores and applied the statistical treatment to be used in the study.
Cost analysis. Since our output will be an application, we don't need a large amount of money. We just need bond paper and the registration of the application. Bond paper, 5 packs a month. It will cost 150 per pack and times 5 is equals to 750 a month. Registration of the application. We just need one and it will cost 4,800 and the total is 5,550 pesos. Schematic diagram. This is the flow of the schematic diagram. The user will give his or her information. He or she will give basic information first like age, address, and etc. Then he or she will give medical symptoms or condition, and it will be submitted to the doctor that you are assigned to. Lastly, that doctor will give his or her evaluation due to your condition. Next.
In this part of our study, we use on questionnaire in the gathering data from the respondents to know the feedback of their reaction and our study, and to observe all the students. The data gathering were arranged using both method and expressed by Likert afterwards arrange the question and the result observation. The question and the result of the observation of respondent, the statistical treatment that researcher choose, and the person coloration coefficient.
Thank you for all the explanation regarding with our research depends. This is the last part. Thank you again. Thank you and good day.
Thank you.